This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
About getting pregnant is that there will be miscarriage. Nature or evolution or whatever we want to call it has meant that the human female will lose a pregnancy at the age of 30, 1 in every 6 pregnancies. So that's 15% of women who become pregnant will actually not continue with the pregnancy. The majority of those are because nature made a mistake with the genetics, and when nature realises that, the pregnancy doesn't continue. Obviously there are some genetic abnormalities that continue through, like Down syndrome, but they're very rare, very uncommon, whereas miscarriage is common. At 1 in 6 chance of a miscarriage, the chance of having 2 miscarriages is 1 in 36, 3%. So 3% of women who have will have a miscarriage twice. So it's not that uncommon. But after 2 miscarriages, we call it recurrent miscarriage, because in addition to the genetic aberrations, mistakes that nature makes, there may be other causes for miscarriage, and it's worthwhile having them investigated. What we look for in terms of potential reasons: the shape of the uterus or scarring within the uterus. That's one thing. The uterus can't hold the pregnancy, or it lands, the pregnancy attaches in a place where it's not going to be nourished as well as other parts of the uterus. So doing ultrasound, maybe looking inside the uterus with a telescope may be helpful. We know that inflammation of the lining of the womb increases your risk of a miscarriage. Then there are things in the mother. Are there things in the mother that might make a pregnancy less possible? To establish a pregnancy, the attachment of the baby to the lining of the womb and the acceptance of the maternal immune system to the baby, to accept the baby, has been a puzzle to science for 100 years. And we still don't understand why something that is only half the woman's genetic makeup, because the sperm gives the other half, why does the body not reject it? If you get an infection, what the immune system does is sees it as different to the mother's what they call antigens, and creates an immune response to help you get over the infection. But for some reason, the uterus accepts the fact that there's half the antigens are not hers. Something goes on, and we still don't understand why. But there are markers that suggest that it might be that as a problem for the miscarriages. There's something called antiphospholipid syndrome. Anyway, we've got blood tests that test that sort of stuff. A tendency towards making blood clots has been associated with recurrent miscarriage. So we go looking for aspects in the blood, gene mutations, and the basic blood clotting tests. We do those to check that they're okay and that you don't need to have any therapy for it. Then outside the uterus, there is a relationship between endometriosis and miscarriage. Having a look inside and seeing if there's any endometriosis is another investigation we may do. The other very uncommon thing is that although you and your partner are normal, appear to be normal genetically, you've got to adulthood, it is possible that there is still an aberration of your chromosome makeup. So what the thing we're talking about is called translocation. So we all have 23 pairs of chromosomes, and to be normal you've got to have all the genetic material on those chromosomes. But if one small branch of one of the chromosomes breaks off and joins up with its partner, so one of the 2 pairs has got more genetic material than the other chromosome, when it comes time to create an egg or a sperm, those 2 pairs split up, and if a sperm, for instance, has the one with less genetic material, although it will fertilise the egg, it may not allow the embryo to develop and miscarriage occurs. So balance it's called a translocation. At about 1 in 150 recurrent miscarriages we find that aberration. It can be dealt with. by doing genetic testing of embryos after IVF. So we've got a way around the other medical conditions that I was talking about before. Again, we've got treatments that can improve the situation, giving steroids if there's an immune problem, giving blood thinners if there is a blood problem. And if there's a uterine problem, either correcting it surgically or medically using hormones is possible. So there's lots of reasons why women have multiple miscarriages. Having had 2 is not such a bad thing, because I can tell you the statistics say any woman that's had 2 miscarriages, when I said before it was a 1 in 6 chance, when they go into the 3rd one, without me finding anything wrong with you and doing nothing in terms of treatment, 75% of you will carry on with a pregnancy. It's hard to believe once you've had 2 miscarriages, the 3rd one has a 75% chance of success, but that's what statistics tell us. So it's bad luck mostly that causes miscarriage, but it's important to rule out anything we can treat and help you have the baby that you so want.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.